Waterloo Secondary School Alumni Association presents Our View for You, an informative series focused on you and your personal development.
Hi, good day. My name is Dr. Shelly Wright. I graduated from the Waterloo High School in 2008. I went on to study medicine at the Royal College of Surgeons in Ireland. And today I am here to discuss what we call hypertension, colloquially known as high blood pressure or my pressure high. Before we continue, I just want to make a medical disclaimer. The information I'm providing here is no way intended or implied to substitute for professional medical advice, diagnosis, or treatment. All medical concerns must be discussed with your primary physician. Okay, so let's get into it. The American Heart Association recommends that anybody above 20 years with a normal blood pressure that is less than 120 over 80 should have yearly screening of their blood pressure. And this is because hypertension is very prevalent in the world. And the World Health Organization estimates that 1 in 4 men has hypertension, 1 in 5 women has hypertension. Now that's a 20 to 25% prevalence of hypertension in the world. Okay, and so why are we so emphasizing this hypertension? What is it about? The reason we do that, and it's a cause for education and concern in the world, is because hypertension is referred to as a silent killer. Okay, silent killer in that you feel great. Your blood pressure could be up to the sky, roof high, and you feel great. You feel like you could run up a mountain, slide down that mountain, swim, go have a smoke, go have a drink. You feel great. You don't feel any chest pain, no headaches, no signs of stroke, no signs of heart attack, nothing. You feel great. And that is worrying because that could be instantly upon you without warning. Okay, so let's talk a little bit about the complications of having a high blood pressure. Basically, wherever there is arteries and high blood pressure, you have destruction. The blood pressure is sufficient enough to damage the walls in the artery, leading to increased clotting and damage to that artery and obstructing the blood flowing through that artery. Now, if that happens in the brain, we worry about hemorrhagic and ischemic stroke. If it happens in the coronary arteries in the heart, we worry that you can have a heart attack. If it happens to the vessels behind the eyes, we worry about retinopathy. You can lose your vision. It happens in the kidney. It can damage the arterioles, the small vessels there that supplies the nephron, and you can end up with end-stage renal failure or kidney failure requiring dialysis. In men, we can see erectile dysfunction. In women, we could have loss of libido. You have a lot of complications associated with an uncontrolled hypertension. So that is why it's so important to have your blood pressure screened and managed. So how do we measure a patient blood pressure? So what we do, we place a cuff over the arm in order to compress the brachial artery. By doing so, we end up with blood pressure readings. That is the measurement of the force in the artery. You end up with 2 readings. There's a systolic blood pressure and a diastolic blood pressure. The value on top usually reflects the pressure exerted in the artery when the heart is pumping. And the value below the systolic is referred to as the diastolic blood pressure. And this gives a value of the pressure exerted against the artery when the heart is in between beats or resting. A blood pressure of more than 140 over 90 is concerning, and you need to visit your primary physician whenever you see this reading. So you go to your primary healthcare provider and say, "Hi doc, I did my blood pressure, say for example, in the pharmacy, and my blood pressure at that time was elevated. I am concerned that my blood pressure will be high because my mom, my dad had hypertension." And so what happens? The doctor won't have you diagnosed with hypertension based on that one reading. And there's reason for that. 2 reasons I'll give today is because your blood pressure fluctuates during the day. Another reason is that patient gets woke up when they come into the healthcare services, and we diagnose them sometimes with white coat syndrome, and that happens when your blood pressure is normal during the day, normal at home, and as soon as you reach in the hospital, as soon as you reach in the health in the clinic, your blood pressure goes up. So we are very careful when diagnosing patient with hypertension. Sometimes also we have the option of having patient keep a blood pressure diary at home. So an example of this is a form like this. You record the date and the blood pressure reading in the morning and the blood pressure reading in the afternoon, and then you come back within a few days for us to review it to see the general trend of that blood pressure, and from that reading average, we are able to then diagnose you with hypertension. Other ways of measuring blood pressure is if you use an ambulatory blood pressure reading, and what that is, you use a monitor and you keep it on you for a period of 24 hours, and that machine will monitor your blood pressure throughout that period, and then we'll see the general trend again and able to diagnose you accurately. So how do we go about preventing ourselves from getting hypertension? The World Health Organization, I found this really nice diagram on the website, and so I'll share it here. Recommends that we decrease our salt intake to less than 5 grams daily. Of course, we have to check our food labels, especially if we like eating tin food, because a lot of the sodium is found hidden in tin foods and processed foods, so we have to watch out. Of course, we have to eat a lot of fruits and vegetables. Avoid fats, the saturated and the trans fat. If we're smoking, try our best to avoid tobacco completely. Try and cut down, try and stop smoking. Okay, and of course to reduce alcohol. It's hard in our culture where our drink for everything is normal, but if we can reduce our intake to 2 drinks per day for men and 1 drink per day for women, that's the recommended healthy intake of alcohol. And 1 drink, I'll just tell you now, the equivalence of 1 drink is about 12 ounces of beer, 4 ounces of wine, 1.5 ounces of 80% proof liquor, or 1 ounce of hard liquor, 100% proof. So yes, those are things that we can do to prevent ourselves from getting hypertension. And what about if we're already diagnosed with hypertension? We should remain compliant with our medication. If we're experiencing side effects, or if you have any questions, talk to your primary physician. There are a lot of antihypertensive medication out there, and of course we can tailor it to meet your needs. It was enjoyable doing this presentation. If there is any question you all have for me, you can email me at dr.shellywright@gmail.com with any comments or questions, and I'll respond to you. Thank you.
For more on these informative topics, like Waterloo Secondary School Alumni Association on Facebook, and subscribe to Waterloo Secondary Alumni 868 on YouTube. Email admin@wssalumni.org for further information. Be sure to order your commemorative alumni polo as Waterloo Secondary School, formerly Waterloo High School, celebrates its 20th anniversary this year.